The patient was dying. His blood pressure had dropped to nothing, his breathing was a rattle, and every surgeon in that trauma room had already run out of ideas. Dr. Callum Reeves, Portland Heights General's most decorated surgeon, the man whose name was on the hospital's fundraising brochures, was standing over the table with his hands trembling and his eyes wide. And in the corner, a quiet nurse nobody ever looked at twice said 6 words. "He's got a tension pneumothorax, left side." The room went still. Then Reeves turned around and told her to get out. If this story already has you hooked, subscribe to my channel, hit the like button, and drop a comment telling me what city you're watching from. I want to see how far this story travels. Now, let's get into it. The trauma bay at Callaway Regional Medical Center smelled like antiseptic and burned coffee, the way it always did at 11:40 at night. The overhead lights buzzed at a frequency that Megan Hart had stopped noticing somewhere around month 4 of working there. 18 months in, she barely registered it. Same with the way the floor tiles squeaked near the supply closet, or the way the call board crackled before an announcement, or the way Dr. Reeves cleared his throat whenever he walked into a room he expected people to already be paying attention to. She had cataloged all of it, filed it away, learned to move around the edges of this place without touching anything that mattered. That was apparently what she was for. Megan was 36 years old, medium height, lean in the way that came from years of being too busy to eat properly rather than any kind of discipline. Her scrubs were always clean but never pressed. Her hair went up in the same blunt knot every shift, not out of vanity, but because hair in your face was a liability, and she'd learned that a long time before Callaway Regional had ever heard her name. She wore no jewelry. She kept a small notebook in her left breast pocket, the kind with the spiral binding, and she wrote things in it in a handwriting so small and compressed that her coworkers had once joked she must be writing in code. Nobody asked what she wrote. Nobody really asked her much of anything, unless they needed something brought from storage. Hart. Donna Kellis, the charge nurse, didn't look up from the workstation. She had the posture of someone who had decided long ago that eye contact with certain people was a waste of her time. Supply room. We're short on saline bags again. 3rd shelf, back wall. Megan was already walking. "I know where they are." "And check the IV tubing while you're in there." "Already on my list." Kellis made a sound that wasn't quite an acknowledgement. Behind her, 2 of the other nurses, Priya and Sasha, both several years younger than Megan, both very aware of the social ecosystem of this department, exchanged a quick look. The kind that said she's already on it, and also why does she let Donna talk to her like that at the same time? Megan didn't catch it. She was already through the door. The supply room was narrow and ruthlessly organized because Megan had organized it herself during a slow Sunday 3 months ago, and nobody had thought to stop her or thank her. She counted saline bags, noted the deficit, gathered what she needed. Her hands moved without hesitation. She'd spent enough time in this room that the inventory lived in her head like a map, every shelf a coordinate. Through the wall, she could hear the ambient noise of the department, monitors, voices at low register, the squeak of a gurney wheel that needed oil. Then the radio at the nurse's station spiked. Megan stopped. She couldn't make out the words, but she knew that frequency, that urgency. She'd heard something like it before, in a different context, in a different life, and her body reacted before her brain caught up. Her shoulders dropped, her breathing slowed, her focus narrowed. She tucked the saline bags under her arm and walked back out. The bay had shifted. The ordinary hum of a late-night shift had cracked open into something louder and less organized. 2 nurses were moving quickly toward Trauma Bay 1. Kellis was on the phone, her voice taut. At the far end of the corridor, Megan could see Dr. Reeves emerging from the break room, already snapping his fingers at his resident, already performing. "What is it?" Megan set the saline bags on the counter. Priya glanced at her. "MVC, bad one. Guy went through a guardrail on the overpass." "How far out?" 2 minutes. Megan nodded and began moving toward the bay. She was still close to the door when Kellis materialized at her shoulder, almost certainly on purpose. "Hart, I heard. You're going to finish restocking and then relieve Sasha at the desk so she can assist in Bay 1. Megan turned to look at her. "There are 3 nurses in there. They're going to need a 4th if it's as bad as we're covered." Kellis's expression was neutral, the way that neutral can sometimes be a specific kind of message. Desk. There was a beat, just long enough to be noticed, not long enough to be insubordination. Megan went to the desk. She sat down, pulled the notebook from her pocket, and wrote something in it. Small letters, tight lines. Then she looked up at the bay window that separated the workstation from Trauma Bay 1, and she waited. The patient came in loud. That was her first impression. Not his injuries, but the noise around him. The paramedics shouting handoff information over each other, the gurney rattling, Reeves already calling for labs and imaging before he'd even examined the man. The patient was somewhere in his 40s, heavy set, and his color was wrong. Grayish, with a blue tinge at the lips that Megan clocked from through the glass. She watched. She kept her posture easy, her expression neutral. From the desk, she was invisible. She was good at that. The team worked. Reeves talked a lot. He always talked a lot during procedures, which his residents had been trained to interpret as confidence, and which Megan had long since identified as something closer to performance. He called for a chest X-ray, ordered a dopamine drip, had someone bag the patient while they set up. 4 minutes in, the patient's pressure dropped. 5 minutes in, it dropped again. The monitor alarm was a flat, persistent tone that made Priya's voice climb. Reeves snapped something at his resident that Megan couldn't quite hear. She leaned forward slightly. His breathing was asymmetrical, right side rising, left side barely moving. She could see it from here, the subtle lag, the way his left chest wasn't tracking. His trachea, if she could see it clearly, would be deviated. She was almost certain. She was out of her chair and at the bay door before she'd made a conscious decision to move. Heart! Kellis behind her. What are you doing? His left side isn't moving. Get back to the... Megan pushed the door open. The room turned. 6 faces, and none of them were glad to see her. Reeves pulled himself up to his full height, which was considerable. He had a face built for authority. Strong jaw, steel gray at his temples, the kind of eyes that had learned to make people smaller. Nurse Hart. His voice was very quiet. This bay is restricted to... He's got a tension pneumothorax, left side. Megan didn't shout it. She didn't have to. His trachea is deviated. He needs needle decompression right now before you do anything else. The room went still. Reeves stared at her. Then, get her out of here. His pressure is already bottomed out, Megan said. She wasn't moving. Every second you'd... Sasha? Reeves turned away from her. Get security if you need to, and call respiratory. He looked at his resident. Continue with the dopamine. That's going to kill him, Megan said, and her voice didn't shake. Someone's hand was on her arm. She let herself be walked backward out of the door. The last thing she saw before it swung shut was the monitor, and the patient's pressure dipping again, and Reeves not looking at it. Was. She stood in the corridor for exactly 37 seconds. Then the code alarm went off. Kellis was already running. Priya dropped the chart she was holding. Through the window, Megan could see the controlled panic of a team realizing they were losing someone, the way it changed people's bodies. Reeves's jaw going tight, his resident going pale, someone starting compressions. And then she saw Reeves look at the chest X-ray that had finally come through on the board. She saw his face change. He grabbed a needle. 16 gauge, which was right. He found the second intercostal space, which was right. And when he decompressed the chest, the rush of air was audible even through the glass, and the patient's pressure climbed on the monitor like a man hauling himself up a cliff face. He wasn't going to say anything. She already knew that. She went back to the desk. 20 minutes later, Reeves came out of the bay with his resident at his shoulder and his composure fully restored. He passed the workstation without looking at her. Nice catch on the pneumo, he said, to no one in particular, in the tone of someone dictating notes. His resident wrote something on a clipboard. Kellis gave Megan a look that she couldn't entirely decode. Megan took out her notebook and wrote something in it. She found out the next morning what Reeves had put in his patient note. She wasn't supposed to see it. She'd been pulling supplies again, and the system had been left open on a workstation that someone had walked away from. But she saw it long enough to read the relevant line. Tension pneumothorax identified by attending. Needle decompression performed. She stood there for a moment, then she closed the screen and walked away. The thing about being invisible was that people stopped filtering what they said around you. She'd learned things that way. She'd learned that Reeves had overruled a cardiology consult last spring and the patient had coded. She'd learned that Kellis had been logging Megan's small errors in a file, a typo in a medication reconciliation form, a missed signature on a discharge document, building something that looked like a paper trail. She'd learned that one of the hospital board members was Reeves's former mentor, which explained certain things about the man's untouchability. She'd also learned which corners of the building had the best sight lines, which exits were monitored, and how long it took security to respond to a call from trauma. Old habits. Megan ate lunch alone in the stairwell between the second and third floors because the break room had a social geography she'd given up navigating. She had a sandwich she'd made at 6 a.m. and a thermos of black coffee, and she sat on the step with her notebook open on her knee and went through her notes. She'd been tracking everything for 4 months, quietly, methodically. Nothing she could do with it yet. But she'd learned a long time ago that information was a kind of preparation. You gathered it without knowing exactly when you'd need it. And then one day you did. Her pager went off. She looked at it. Supply run. Third floor orthopedics needed compression bandages. She closed the notebook, capped her thermos, and went back to work. What? The next 3 days had the specific texture of late autumn in a trauma unit, a sustained, grinding busyness that left no room for drama, but also no room for rest. 2 motor vehicle accidents, a farm equipment injury that took 4 hours to stabilize, a pediatric case that nobody talked about afterward, but that everyone carried home with them. Megan worked her shifts and kept her head down and did the things that nobody else noticed needed doing. She recalibrated the suction canisters in Bay 3 because they'd been running slow and no one had flagged it. She noticed that one of the residents, a young man named Torres, consistently misread venous blood gas results under pressure, and she'd twice now set him up with the right answer without making it visible that she was doing it, asking a question that pointed him in the right direction, pulling the right reference material to where he'd find it. He thought he was figuring things out himself. She let him think that. It was something she did. Something she'd always done, like the work that didn't have a name, the calibration that kept systems from failing. The military had a term for it. Civilians usually didn't. On the 4th day, Reeves called her into the break room after her shift. He wasn't alone. Kellis was there. And so was a man Megan didn't recognize, administrative by his clothes and the specific way he held his pen, like a prop. HR, maybe. Risk management. Sit down, Reeves said. She sat. We're conducting a review of the Torrance case, he said. Torrance was the pneumothorax patient. She'd already known this was coming. There are some inconsistencies in the documentation, a question about whether the nursing staff intervened in a clinical decision outside their scope. I identified a tension pneumothorax, Megan said, communicated my assessment to the attending. You entered a restricted trauma bay after being directed to leave. The patient was about to die. Nurse Hart. The administrative man spoke for the first time. His voice had the practiced evenness of someone trained in conflict management. I want to be clear that this isn't a disciplinary meeting. We simply need to understand it's a documentation issue, Reeves said over him. The patient's chart reflects the clinical decision made by the attending physician. If there's a narrative circulating that suggests otherwise, we need to make sure the record is accurate. Megan looked at him. She didn't say anything. We're going to ask that you limit your scope going forward to your designated responsibilities. Supply management, patient transport assistance, charting support. He said it carefully, calmly. You're a solid support worker, Megan. I don't want this to become something it doesn't need to become. Support worker. She kept her face even. Is there anything you'd like to add? The administrative man asked. She thought about the notebook in her breast pocket. She thought about the note she'd seen on the screen. She thought about a dozen things she knew how to do that Callum Reeves would never in his life be able to execute, not under the conditions she'd executed them in. No, she said. She stood up, smoothed her scrubs, and walked out. The shift that Friday started normally enough. Megan arrived at 7 p.m., did her handoff review, started her supply inventory. The department was running at about 60% capacity. A quiet night, early, the kind where you knew better than to trust it. She stocked Bay 2, recalibrated the mobile crash cart, Checked in with the overnight resident who had the slightly frantic energy of someone who'd had too much caffeine and too little supervision. At 9:15, Kellis stopped her in the corridor. "I need to talk to you about something." She had a folder, which meant it had been planned. "I've been reviewing your shift documentation for the past 90 days. There are a number of concerns." Megan waited. Kellis opened the folder. Inconsistent charting timestamps. 2 instances of deviating from approved supply protocols. 1 incident where you administered discharge instructions without the supervising nurse present. Mrs. Avery was about to miss her ride. The supervising nurse was on break and unavailable. That's not the process. The patient was Megan. Kellis's voice was patient in the way of someone who had rehearsed this. "I'm not trying to make this adversarial, but we've had concerns for a while, and the Torrance incident brought things to a head. Your performance review is coming up, and I want to give you a fair chance to understand where you stand." She closed the folder. "I'd recommend you start thinking about whether this is the right fit for you." The corridor was quiet. Somewhere down the hall, a monitor beeped steadily. Megan looked at Donna Kellis, at the carefully neutral expression and the folder and the way she was holding her shoulders, and she understood exactly what was happening. She'd been in institutions long enough to know when the paperwork was being assembled. "I understand," Megan said. She went back to work. At 11:30, her pager went off with a code she didn't recognize. Not a standard trauma alert. Not a code blue. She'd been at Callaway Regional long enough to know every page code they used, and this one, 4 digits, not 3, didn't belong to their system. She looked at it for 3 full seconds. Then she heard it. The sound came from outside, which was wrong. Trauma units didn't get sound from outside, not usually. The building absorbed the city. You heard controlled things, engines in the ambulance bay, the ramp hydraulics, traffic from the overpass if the loading dock door was open. This was different. It was rotary. Low and heavy and sustained, not a police helicopter, not a news bird, something larger, something military, and it wasn't passing over. It was slowing down. Megan walked to the window at the end of the corridor. Through the glass, she could see the rooftop of the East Wing. Callaway Regional had a medevac pad up there, rarely used, mostly a formality for the hospital's trauma designation. And the lights coming down toward it weren't civilian lights. They were red over white, and there were too many of them, and the aircraft descending through the wet November air was a Black Hawk, with its running lights on and its cargo bay door already open. She counted the people visible in that open door. Armed, all of them. She turned around. Kellis was at the end of the corridor, staring at the same window, her folder gone slack in her hand. The overnight resident had come out of Bay 2 and was looking up. Even Reeves, who was still somewhere in the department finishing late rounds, had emerged from a room and was standing with his arms at his sides and the confident expression temporarily absent from his face. The overhead intercom crackled. "Trauma team to the rooftop medevac bay. Trauma team to the rooftop medevac bay. This is a Priority 1 activation. Military transport inbound. All available personnel to the east stairwell." It said it once, then again. Megan was already moving, not toward the east stairwell, toward the supply room. She knew something the rest of the team didn't know yet, and it was already arranging itself in her mind like a checklist she hadn't needed in over 2 years. What military medevac carried? What military medevac didn't carry? The gap between their kit and a civilian trauma unit's inventory. What she'd need. She was pulling a trauma chest pack from the 3rd shelf when Kellis appeared in the doorway. "Hart, I said all available." "I know." Megan kept moving. "Go upstairs. I'll be right behind you." "You're not on the trauma team. Go upstairs, Donna." Something in her voice stopped Kellis. Not loudly, not forcefully, just stopped her. The way certain tones did. The way certain people carried an authority that had nothing to do with their job title and everything to do with something older and less negotiable. Kellis went upstairs. Megan spent 90 seconds in that supply room, gathering specific things. Then she followed. The rooftop was cold and loud and smelled like rain and aviation fuel. The Black Hawk had touched down on the pad, rotors still turning, and the men coming off it moved with the controlled velocity of people who had a very small amount of time and knew it. 3 of them were operators, armed in plate carriers and subdued patches, faces covered against the rotor wash. Behind them, 2 more were carrying a stretcher. The man on the stretcher was in bad shape. Megan could see that from 40 feet away, and still she kept moving, not running, but not walking either. The particular pace of someone who has learned that urgency is most effective when it looks like certainty. The rooftop medevac bay had a direct elevator to the trauma floor, and the hospital team was clustered near it. Reeves in the front, 2 residents behind him, Kellis to one side, 3 nurses. Standing in front of the elevator, blocking the team's path, was a man in military uniform. He was a special operations captain, early 40s, the kind of physical presence that took up more space than its actual dimensions warranted. He had a headset around his neck and a tablet in his left hand, and an expression that Megan could read from here. The specific look of someone managing a crisis and not at all sure the resources in front of him were adequate. Reeves was already introducing himself. Dr. Callum Reeves, Chief of Trauma Surgery, Callaway Regional. I'll be leading this. Captain Alan Brody, the man said. 7th Special Operations Support Group. This is a classified medical emergency. Before we transfer the patient, I need to confirm your trauma team has capability for... We are a Level 1 trauma center, Reeves said. Whatever your man needs. What's his hemodynamic status? Megan asked. Both men turned. She was standing 5 feet behind Reeves. She'd placed herself there deliberately, in the space where she could see and not be easily sidelined. Brody looked at her. His eyes did something that the other eyes in this group did not do. They evaluated instead of dismissed. Not long, half a second, but specific. Hemorrhagic shock, 3rd degree, he said. We've got 2 large-bore IVs running wide open, lost about 3 liters estimated. There's a penetrating injury to the right upper quadrant and a second injury pattern we haven't fully characterized. He's been down approximately 32 minutes. Blood type? Megan asked. O negative. Our blood supply is depleted. What's his pressure? 72 systolic when we loaded him. Couldn't hold a line on the way here. What's the second injury pattern? Brody paused, a very short pause. That's the part we need to discuss with your team privately. Reeves cut back in. Captain, I appreciate the briefing. If you'll let us take the patient, his pressure won't survive the elevator without intervention, Megan said. She said it calmly, looking at Brody, not Reeves. He needs at least 2 units of packed red cells pushed before you move him. If you're running open IVs on a 3rd-degree hemorrhagic shock patient and his pressure is 72, his vascular tone is gone. He won't tolerate the position change. Brody stared at her. On the stretcher, 10 feet away, the patient, a large man, broad-shouldered, somewhere in his late 40s, was visibly deteriorating. His color was wrong. His breathing was shallow and too fast. Who are you? Brody said. Megan Hart, she said. I'm a nurse. He looked at her for another second, and something moved across his face that she couldn't quite name. Then his hand went to the radio at his shoulder, and from somewhere behind the operators, a voice said something in a low, rapid frequency that the rotor wind mostly swallowed, and Brody went very still, and he looked at Megan again with an expression that had completely changed. Get the blood from the aircraft, he said to one of his men. Then he turned to Reeves. Your team can proceed downstairs. I need a moment with this nurse. Reeves blinked. I'm sorry? Downstairs. Brody's voice didn't change. Now. Reeves looked at Megan. The expression on his face was one she hadn't seen before. Masas. Not condescension, not dismissal, but something else, something uncertain. He went downstairs. On the rooftop, with the rotors slowing and the wet, cold air and the city laid out in lights below them, Captain Alan Brody stepped toward her. Major Hart, he said, quietly, like a question that already knew its answer. Megan didn't flinch. I go by Megan now, she said. He held her gaze for a moment. Then he looked at the man on the stretcher and back at her. He's not going to make it without you, Brody said. And there's something in that wound you need to know about before anyone else goes in. The wind picked up. Below them, traffic moved on the overpass. Somewhere in the building, an elevator hummed. Megan looked at the patient, at the monitors clipped to the stretcher railing, at the careful way the operators had positioned themselves around him, not just as guards, but as people who understood they were standing next to something that could kill them all. "Tell me about the second injury," she said. And the night cracked open. Brody didn't waste time with preamble. That was the first thing she noticed. No throat clearing, no careful setup, just the facts the way people delivered them when the facts were the kind that required action. "Penetrating trauma to the right upper quadrant, we already told you that. What we didn't say is that the entry wound has an atypical profile. Too clean for shrapnel, too irregular for a standard round." He pulled out his tablet, angled it toward her. The image was a field scan, low resolution, the kind you got from portable equipment in a moving aircraft. "Our medic found a density anomaly at the wound base. Something's in there that shouldn't be. Command has already been notified. They believe it's a fragment from an experimental ordnance system that was recovered from a hostile site approximately 6 hours ago." Megan looked at the scan image. She looked at it for 4 seconds, which was longer than she needed. "Pressure sensitive?" she said. "Possibly. We don't have full specs. The program it came from is 3 levels above my clearance." He kept his voice flat, which took effort. She could see that. "What we know is that it's not inert. Our EOD liaison is 40 minutes out. The patient doesn't have 40 minutes. She handed the tablet back. "Who else knows about this?" "My team. Command. Now you." "Not Reeves." "No." She looked at the man on the stretcher again. He was big. Ex-operator. She'd have guessed even without context. The kind of physical build that came from years of functional training rather than aesthetics. His face was slack in the way of deep shock. His lips were pale. The oxygen saturation on the portable monitor was reading 91 and trending down. "His name," she said. Brody hesitated for just a moment. "Commander Dale Rourke, 7th Group, 22 years. She filed that away. Not because it changed anything clinical, but because she'd learned a long time ago that keeping a name in your head, the actual name, not the injury, not the case, was the difference between a procedure and a person. It kept your hands honest. "All right," she said. "Here's what's going to happen." But getting Rourke downstairs without killing him took 11 minutes, and those 11 minutes were the kind that aged you. The operators had the blood, 2 units of O negative from the aircraft's medical kit, and Megan pushed them both wide open through the existing IVs before they moved him, standing at the stretcher with her fingers on his radial pulse, counting, while the rotor wash died down around them, and Brody talked quietly into his radio. His pressure climbed to 84 systolic by the time they hit the elevator. Still not safe, but survivable, which was a different category. The elevator opened onto the trauma floor and the hospital team was waiting. Reeves had rearranged himself into authority while she'd been upstairs. He was at the front of the cluster, sleeves rolled, the resident Torres at his left shoulder, 2 nurses flanked behind. He'd put on the face, the one that said, "I have this." He didn't have this. Megan was already calculating what he didn't know and what it would cost to keep telling him. "Bring him in," Reeves said, stepping back to let the stretcher through. He fell into stride beside it, already beginning his assessment, talking to the operators, asking handoff questions, reaching for Rourke's chart. "What do we know about mechanism? Penetrating, you said? I'm going to want an immediate CT." "No CT," Megan said. Reeves stopped. The stretcher kept moving. "I'm sorry?" He turned to look at her. "He can't go to CT." She kept walking. "He needs direct surgical assessment, in-bay. No imaging beyond portable." And why exactly is a supply nurse making that determination? Because the imaging suite is isolated and you'd be moving him further from surgical capability. That was the part she could say. The part about the fragment she wasn't going to put in a room full of people who hadn't been cleared for it. His pressure is still in the basement. You move him to imaging and he codes in the machine. Reeves's jaw tightened. He looked at Brody, who had come off the elevator behind them. "Captain, I'll need your team to step back and let my people work." "My team stays with the patient," Brody said. "This is a civilian medical facility. And this is a classified military casualty." Brody's voice hadn't risen. It didn't need to. "You can treat him. You can't remove my personnel from the room." Reeves held his ground for a moment, the practiced stance of a man who was accustomed to being the largest authority in any space. And then something in the math shifted, and he turned and walked into the trauma bay. Megan followed. Kellis was at the supply cart. Torres was pulling up lines. The other nurses were setting up for a standard penetrating abdominal trauma. Efficient, correct for what they thought they were dealing with. Rourke was going to die if this stayed standard. The first escalation came 7 minutes in. His pressure dropped again, from 84 to 61 in under 2 minutes without warning, which meant he was bleeding somewhere they hadn't found yet. Reeves called for a fast exam, got the ultrasound probe, and found free fluid in Morrison's pouch. He called it correctly. Internal hemorrhage, liver involvement. He wanted to go to the OR. Not yet, Megan said. She was standing at the foot of the bed. She'd taken the position without thinking about it, the one that let her see the whole room, the patient, and every monitor simultaneously. Old reflex. Heart. Reeves didn't look at her. I've told you. He has a second injury. Right upper quadrant, deep to the liver laceration. She had Brody's eyes on her from the corner. She chose her words carefully. If you go in for the hepatic injury without knowing what you're working around, you're going to hit something you can't manage on a surgical table. Silence. The monitors kept going. Torres looked up from the IV line. Kellis had stopped moving. Reeves set the ultrasound probe down. He turned, slowly, and looked at her. What exactly are you telling me? I'm telling you that I need to do a manual assessment of the wound base before you take him to surgery. I need 5 minutes and a specific instrument set, and after that I'll tell you what you're working with. You're a nurse? Yes, a supply nurse. If we could skip this part, she said. He has about 8 minutes before his pressure drops below sustainable. The room was very still. Reeves looked at Brody. Brody said nothing. He just looked back in that particular way that communicated something Reeves clearly couldn't decipher, and it frustrated him. She could see the frustration, the edges of it, but he was also, under everything, a trauma surgeon, and trauma surgeons knew what a crashing pressure curve looked like. 5 minutes, Reeves said. Then we go to surgery and I'm leading. It wasn't agreement, it was concession. She took it. I need a long Kelly clamp, malleable retractor, surgical light, and the instrument tray from Bay 3. She looked at Kellis. The trauma chest pack I brought from upstairs. It's on the supply cart. I need the secondary pouch inside it. Kellis didn't move immediately. Donna, Megan said. Please. Something in that please. Not weakness, not apology, just the specific weight of someone asking for what they needed without dressing it in performance, made Kellis move. She worked fast and she worked quiet, which was how she'd always worked. The wound was in the right upper quadrant, lateral border, and the entry profile was exactly what Brody's scan had shown, atypical, which in her experience meant precision-made rather than incidental. She extended the examination carefully, gloved and lit, her fingers reading the tissue geometry the way you read it. When you'd done this in places where there was no imaging and no backup, and the person under your hands was the only thing between a mission and a catastrophe. She found the fragment at about 4 centimeters depth. She didn't touch it. She'd expected to find it, and she'd expected it to be small, and it was smaller than her thumbnail, irregular, with a surface texture that was not metal. She'd seen 2 things like it before, in a different context, and both times the standing order had been the same. Mark the location, stabilize the surrounding tissue, do not manipulate. She withdrew her hand, pulled off her outer glove, looked at Brody, who was watching her from the corner with an expression that had gone very careful. She gave him a single nod. His hand went to his radio again. Rourke's monitor alarmed. He's dropping, Torres called out. 60, 58. Get a pressure bag on the second unit, Megan said, snapping back to the patient. And get the OR on the phone right now. Tell them we need a room. Reeves pushed past her to the head of the bed, and she let him because the surgery was his for the next part. What she knew, and what he didn't, was the geography of what was inside that wound, and that was the information he needed to keep Rourke alive on the table. She started talking, fast, specific, precise, exactly where the fragment was, how deep, the orientation, what tissue it was adjacent to, what margin he'd need to leave around it. She talked the way she talked when it was dark and loud, and there was no time for anything but clarity, and she didn't look at Reeves's face while she did it, because she could hear the shift in his breathing, and that was enough. He was listening. He didn't like it, but he was listening. Torres had the OR on the line. Kellis was already calling for the transport team. The operators had fallen into a practiced efficiency around the stretcher, the kind that came from having done this, not from training. Megan stepped back from the bed. Her hands were steady. They were always steady, which she'd once explained to someone as a kind of gift, and had later revised to a kind of cost. The steadiness came from something she'd built deliberately, over years, out of materials that were not particularly pleasant. She stripped her gloves and dropped them in the biohazard bin, and Captain Brody was at her shoulder. EOD is 22 minutes out, he said, very low. They're coming in dark. No official hospital notification. What's the OR situation? Fragment is stable if it's not manipulated. You told Reeves where to leave margin. If he's as good as his reputation, he's technically good, Megan said. He just needs to be managed. Brody made a sound that wasn't quite a laugh. Welcome back, Major. I told you, she said. Don't call me that. He didn't argue. He also didn't stop watching her with the look he'd had since the rooftop, the one she'd cataloged and set aside and was now, unavoidably, going to have to deal with. Who else is inbound? She asked. Colonel Tran is 30 minutes behind EOD. He'll want a full debrief. On Rourke or on me? Brody was quiet for a moment. Both. She'd expected that, too. The OR team took Rourke at 12:41 a.m., and Megan stood at the scrub sink outside OR2 and watched the doors close behind him. Reeves was inside, gowned up, and she'd spent the 4 minutes before he went in giving him a precise and detailed verbal map of the wound field. Where to go first, where to stop, exactly how much margin to leave around the fragment's location. He'd asked one clarifying question. She'd answered it. He hadn't thanked her, and she hadn't expected him to. The corridor outside the OR suite was quiet. The operators had taken up positions at the stairwell doors, which was going to raise questions from hospital security eventually, but that was a problem for a different minute. Kellis was waiting at the end of the corridor. Megan had seen it coming. The expression on her face had been building since the trauma bay. The specific look of someone who has witnessed something that doesn't fit the story they've been working with, and who hasn't yet decided what to do with the discrepancy. Kellis was not a stupid person. She was a limited one, which was different. What's happening? Kellis asked. The patient is in surgery. That's not what I mean. She kept her voice low, which was a credit to her. Reeves did everything you said. He didn't question it. He's been doing this for 20 years and he did everything you said. She stopped. Who are you? Megan looked at her for a moment. Charge nurse, Callaway Regional. Megan. That's the answer I'm giving you right now, Donna. Kellis stared at her. Then she nodded, once, the way you nodded when you knew you weren't going to get more and you'd decided to accept that rather than push, and she walked away back down the corridor. Megan turned back to the OR doors. Her reflection was in the small windows set into them, blurred, distorted by the wire mesh in the glass. Scrubs, hair up, the spiral notebook in her breast pocket. She looked like what she'd been telling everyone she was for 18 months. She looked nothing like what she actually was. Behind her, she heard new footsteps. Not Kellis's, not Brody's. Faster, with a specific cadence. Two people, moving in sync, the way you moved when you'd operated as a unit for a long time. She turned. Two men in civilian clothes, but the civilian clothes were a uniform in their own way. The cut, the footwear, the posture. One was carrying a hard-sided case, matte black, with two combination locks. The other had his hand on a radio. EOD. She checked her watch. 19 minutes. They'd made good time. The one with the case stopped in front of her. He was mid-30s, compact, with the focused energy of someone who lived in a very specific range of operational conditions. Are you the one who assessed the fragment? Yes. Location is confirmed 4 centimeters, right upper quadrant, lateral margin, adjacent to the inferior border of the liver? Yes. Orientation? Slightly lateral, angled about 15 degrees toward the midline. He looked at his partner. Some kind of communication passed between them that didn't need words. We're going to need to be in that OR, he said. The surgeon is in active surgery. I know, we still need to be in there. He looked at her steadily. Is that going to be a problem? She thought about Reeves's face when Brody had told him to go downstairs. She thought about his face again in the trauma bay when he'd looked at her and stopped knowing what category to put her in. "Let me handle it," she said. She pushed through the OR doors. Thus, the room did not stop. It was a running surgery, and running surgeries had a momentum that didn't acknowledge interruptions, but heads turned. The scrub tech at the instrument table looked up. One of the circulating nurses started toward her. Reeves was at the table, deep in the hepatic injury, and he looked up with eyes that were bright with concentration and annoyance in equal measure. "Hart, this is a sterile. EOD needs to be in here," she said. "Right now." "Absolutely not." "The fragment I told you about," she said, keeping her voice below the monitor noise. "It's not surgical waste. They need to manage it when you get to that layer." Reeves stared at her over his mask. The anesthesiologist, who had been quiet at his station, looked at the circulating nurse, a small, loaded look. "What kind of fragment?" Reeves said. "The classified kind." She held his gaze. "I know that's not what you want to hear right now. I also know you're about 40 minutes from reaching that level of tissue, which gives us time to brief them and set up a secondary protocol. But they have to be in this room when you get there, and they have to be the ones to extract it." The monitors beeped. Rourke's pressure was holding, barely. "If I call OR security..." "You can do that," she said. "And then, when Colonel Tran arrives in 25 minutes, you can explain to him why you denied his EOD team access to his operator and a classified ordnance fragment." She paused. "Or we can do this the right way." Reeves looked at his hands, both of them, still in the wound field, precisely positioned, holding the margins she'd told him to hold. He'd been doing exactly what she said. He'd been doing it for 40 minutes already, in a surgery that was going exactly right because he'd done exactly what she said. He knew it. She knew it. In a couple of minutes, everyone else in this room was going to know it too. "Let them in," he said. Megan stepped back to the door. She pushed it open and looked at the EOD tech with the case. "You're in," she said. He moved past her into the OR without a word, his partner behind him, and as Megan stood in the threshold, she heard the distant sound of an elevator arriving at the end of the corridor and new footsteps, heavier, more, a whole group of them. And when she looked up, Captain Brody was walking toward her fast, and behind him were 4 more operators and a man in uniform who carried himself the way people carried themselves when they were used to entire rooms rearranging around their presence. Brody reached her first. "Colonel Tran is early," he said, "and he's not alone. There's a military legal officer with him." He stopped. "Megan, whatever you've been doing here for the past 18 months, whatever you told people, whatever name you were using, it's about to be a lot harder to maintain." She looked past him at the group coming down the corridor. The colonel was already looking at her, and the expression on his face was not the expression of someone who didn't know exactly who she was. Colonel Victor Tran walked like a man who had never once in his life needed to raise his voice to get a room's attention. He was 61, lean, with close-cropped gray hair, and the kind of posture that came from decades of physical discipline rather than vanity. His uniform was correct in every detail. He wore no expression that could be read at a distance, which was its own kind of expression. He stopped 6 feet from Megan. Behind him, the legal officer, a woman, major's leaves on her collar, a face that was professionally blank, held a folder against her side. The 4 operators fanned out with the quiet efficiency of people following a standing protocol. Brody had stepped back. Not far, but back. Tran looked at Megan for a long moment. He looked at her the way you looked at something you'd been expecting to see and weren't sure whether to be relieved or troubled by. "You're harder to find than you used to be," he said. "I wasn't hiding," Megan said. "I was working. 18 months as a supply nurse in a civilian trauma unit. I have a nursing license. You have 7 certifications above that nursing license that this hospital has no record of." He glanced at the OR doors behind her. "How's Rourke?" "In surgery. EOD is managing the fragment. He's going to make it if Reeves doesn't deviate from the margins I gave him." Tran processed that. "And the fragment is stable?" "It was 4 minutes ago." He nodded, once. "Then I need 10 minutes with you before the situation in that OR becomes anything else." He didn't wait for her answer. He walked to the family waiting area at the end of the corridor, empty at this hour, and sat down with the specific economy of a man who sat down when he had something to accomplish and stood up when he was finished. Megan followed. The legal officer took a position near the door but didn't sit. Megan noticed she didn't open the folder. "You went dark 2 years and 3 months ago," Tran said. "You left a forwarding address that turned out to be a mail drop in Bend, Oregon, and a resignation letter that was 4 sentences long and said approximately nothing. It said what it needed to say. It said you were done." He looked at her. "Were you?" She didn't answer immediately. Through the wall, she could hear the muted activity of the surgical suite. Not words, just the ambient sound of people doing work. "I needed to be somewhere different," she said. "And here? Supply runs and charting support?" "It wasn't just that." "No," he said. "I know it wasn't." He leaned forward slightly. "I read your informal assessments of the department's safety gaps. You flagged them in their own internal system under a different staff account. I know the resident Torres has been making better diagnostic calls for the past 2 months, and I'd be very surprised if that was coincidence. I know the crash cart in Bay 3 was recalibrated in October, and the person who signed off on it used initials that don't match any nurse on the roster." He paused. "You've been doing the job anyway. You just made yourself invisible while you did it." She said nothing. There wasn't much to say. "I also know what Kellis has been building," he said. "The file, the timestamps. They were going to push you out within 60 days. His voice didn't change. "How long were you going to let that run?" "As long as it needed to." He studied her. "You were going to leave quietly." "I was going to leave when I was ready. And Rourke falling out of the sky at 11:30 at night. Wasn't part of the plan," she said. "No." He sat back. For a moment he looked his age. Not old, but tired in a specific way. The tiredness of someone who had been managing consequential things for a long time and knew exactly how much it cost. "I'm not here to drag you back," he said. "I want you to understand that. The legal officer is here for the fragment documentation, not for you. Whatever you choose to do after tonight is your choice." He looked at her steadily. "But I need you in that OR if anything goes sideways, and I need you operational for the next 3 hours. After that, I give you my word, this conversation ends the way you want it to." Megan looked at her hands. There was a small smear of blood on her left index finger, dried, that she'd missed when she'd changed gloves. "Rourke's. 3 hours," she said. 3 hours. She stood up. "Then let's go." The surgery was running clean when she pushed back through the OR doors, which was either Reeves being as technically capable as his reputation suggested, or the specific mercy of a situation that had already pushed its luck as far as it was going to. Probably both. The EOD tech with the case, she'd learned his name was Garrett, had set up at the perimeter of the sterile field. He and his partner had conferred in low voices with the anesthesiologist and the scrub tech and established a protocol that everyone in the room now understood. When Reeves reached the defined tissue layer, he would stop. Garrett would move in. The extraction of the fragment would happen under EOD management, not surgical. After that, Reeves could close. It was an unusual arrangement. Unusual was a considerable understatement. Reeves was handling it the way he handled most things, with the surface composure of a man who was not going to let anyone see the edge of his uncertainty. But Megan had been watching him long enough to read the things he didn't show, and she could see it. The slight extra deliberateness in his movements, the way he asked his scrub tech for instruments a beat earlier than he needed to, the set of his jaw. He was working carefully, more carefully than he usually did. That was her doing, and she knew it, and she didn't waste time deciding how she felt about it. She moved to the position on his left side where she could see the wound field without touching the sterile zone. "How far?" she said quietly. "About 20 minutes, Reeves said. He didn't look up. "Your margins have been accurate." She noted that he'd said your margins. Not the margins. He was a precise person, under everything, and precision sometimes had a way of slipping out. "The inferior hepatic tissue is going to want to move when you retract," she said. "Hold the retractor manual, don't lock it." "I know how to manage liver tissue, Hart." "I know you do. The anatomy in this case is shifted from the hemorrhage. You'll feel it when you get there." He didn't respond. He didn't need to. She could see the slight adjustment in his grip on the retractor, the small accommodation that meant he'd heard her. Torres was managing the anesthesia side with the attending anesthesiologist, and he was doing well. He'd grown in the 2 months she'd been quietly putting the right information in front of him. She watched him work and noted it, the way she noted most things, in the back of her mind where the running inventory lived. Garrett was at her shoulder. "How confident are you on the fragment orientation?" he said. Low, intended only for her. "As confident as I can be without imaging. If we go in and it's rotated, then we adapt," she said. "Same as every other time." He looked at her. "You've done fragment extractions before." "I've been adjacent to them." "Adjacent." "In active field conditions," she said. "With less equipment than you have right now and more variables." He was quiet for a moment. Then, "What's your read on the device type?" She thought about the surface texture she'd felt, the size, the specific irregular geometry that wasn't accidental. Shaped for penetration and retention, not immediate detonation. It's designed to stay in and destabilize over time, or to respond to a specific trigger. Electrical? Or pressure differential, which is why no CT. Garrett looked at the OR ceiling for a moment. Then he looked back at the field. "You knew all of this on the roof." "I suspected." "And you made the call to manage it in hospital rather than call for immediate evac." "Evac would have taken longer than he had." She kept her voice level. "And moving him with an unknown fragment in a pressure change could have triggered it," Garrett said. "Yeah." He paused. "That was a significant call to make, Major." "Don't," she said. He closed his mouth. She felt him reassess. "Sorry," he said, and he sounded like he meant it. Reeves reached the critical layer at 2:08 a.m. "Stopping," he said. It came out very flat, very controlled. He withdrew his instruments to the safe margin Megan had specified, and then he stepped back from the table with the posture of a man doing something he had never done before in his surgical career, removing himself from his own operative field. Garrett moved in. The next 11 minutes were the quietest 11 minutes Megan could remember in a long time. Nobody talked. The monitors beeped at their steady intervals. The anesthesiologist's breathing was audible. Torres had gone very still at his station. Garrett worked with the specific economy of someone who had done dangerous things in small spaces for long enough that it had become a kind of fluency. His partner was at his side, handing him instruments from the EOD kit with the wordless coordination of long practice. The case sat open on a separate instrument table, its interior lined with material that Megan recognized and didn't look at for too long. She watched the wound field. The fragment came free at 2:17. She heard Garrett exhale, quietly, through his nose, the sound of someone releasing a tension they hadn't let themselves fully acknowledge while it was ongoing. His partner had the containment unit open. Garrett placed the fragment in it with a steadiness that Megan respected and sealed the lid. The room breathed. "Clear," Garrett said. Reeves was back at the table in 3 steps, instruments back in hand, and he closed with the precise efficiency of someone who'd been holding it together and was now finally allowed to just be a surgeon again. Megan watched him close and thought, under other circumstances, he was probably very good at this. He was technically excellent. The problem was never his hands. It was the space between his competence and his certainty, the place where he'd decided his capability was absolute, and what filled that space wasn't knowledge. It was performance. She wondered if he'd feel any of tonight differently. Probably not immediately. People didn't usually. At 2:41 a.m., Reeves called it. "We're closing." She went to the scrub sink. She stood at the sink and ran the water hot and washed her hands and looked at her reflection in the metal of the paper towel dispenser, which gave back a distorted version of her face, stretched and indistinct, the way she'd looked at herself in the OR door window earlier. She thought about the last 2 years, about the mail drop in Bend, about the first shift at Callaway Regional, when she'd walked in with her nursing credentials and her compressed handwriting and her habit of cataloging everything, and she'd thought, here's where you don't have to be what you were. That had lasted 18 months and 3 days. The door opened. She'd expected Brody. It was Kellis. Donna Kellis stood in the doorway of the scrub room with her arms at her sides and an expression that Megan had never seen on her before. Not the managed neutrality, not the administrative patience, not the strategic distance. This was something rawer than any of those. "He's out of surgery?" Kellis asked. "Closing now. And he's going to make it." "Yes." Kellis was quiet. The ventilation hummed. "The things you said in the bay, the way Reeves listened to you." She stopped. "I've never seen him listen to anyone like that." Megan dried her hands. "He's a good surgeon when the information is right." "He ignored you for 18 months. He did. And so did I." Kellis's voice was very even, which Megan had a feeling was costing her. "I built a file on you, timestamps and protocol deviations. I was going to push you to resign before your review." "I know. You knew." "I suspected," Megan said. "I knew for about 6 weeks." Kellis stared at her. "And you just stayed." Megan turned to face her. "I had a reason to stay, and then I didn't, and I was working up to leaving." She paused. "Tonight wasn't part of anyone's plan." "Who are you?" The question came out the same way it had before, in the corridor, but with a different weight behind it. Not frustrated, not demanding, genuinely uncertain, the way you were uncertain when the story you'd been telling yourself about someone cracked entirely open and you had to start from nothing. Megan thought about what Tran had said. 3 hours. Your choice. "Right now," she said, "I'm the person who just helped keep your patient alive." She moved toward the door. "That's enough for tonight." Kellis didn't move out of her way. For a moment they stood close to each other in the narrow scrub room, and Kellis looked at her with an expression that was working toward something. Not quite an apology, not quite a question, something in between. "The folder," Kellis said. "The documentation file. I'm going to pull it." Megan looked at her. "I'm not doing it because I think it makes us even," Kellis said. "I'm doing it because I should have done it 2 months ago when I started understanding something was wrong with the picture I had of you." She stopped. "That's all." Megan held her gaze for a moment. "Thank you," she said. She went back out into the corridor. Colonel Tron was at the nursing station. He wasn't alone. The legal officer was beside him, and she now had the folder open, working through something on a tablet that she was reviewing with the focused speed of someone who'd been given a specific task and a specific deadline. Brody stood a few feet away, monitoring his radio in the low-traffic way of someone waiting for a status he expected to be good. Tran looked up when Megan came out. "Fragment secured," she said. "Garrett confirmed. Good work." He watched her cross the corridor. "Rourke's pressure held through closing. He's going to recovery in 10 minutes. Who's covering post-op monitoring?" "My medical officer is inbound. He'll interface with your recovery team." He paused. "Your former recovery team." She sat down on the bench along the wall. Not because she needed to. She wasn't tired, not physically, not yet, but because she'd been on her feet for 6 hours, and there was a particular kind of accumulated tension in her body that needed a moment to settle. "The hospital board is going to have questions," she said. "They're already having them. My legal officer is preparing a briefing. The classified elements won't be disclosed, obviously. What will be disclosed is that a Callaway Regional staff member provided critical medical support for a military casualty and that the operation was successful." He looked at her. "Your name will be in that briefing." "I know." "You don't seem upset about it." "I'm not thrilled," she said, "but I knew when I went to the roof that this was going to open things up." Tran looked at the floor for a moment. "When Brody called in from the aircraft and gave me the situation, he told me the nurse who'd come to the roof knew about pressure differentials and fragment behavior." He looked up. "I knew it was you before he finished the sentence. Because of the fragment knowledge. Because of the way he described how you were standing," Tran said. "He said, she was calm in a way that meant she'd been here before. That's a specific kind of calm." Megan said nothing. "You spent 11 years in the most demanding trauma environments the military runs," Tran said. "You trained 3 cohorts of field surgeons. You were the primary medical authority on 6 classified operations, 4 of which are still sealed above my clearance level, and I am a colonel." He kept his voice measured. "And you've been restocking supply rooms and getting talked to like your furniture." She looked at the floor. "It wasn't nothing," she said after a moment. "The Torres kid, he's going to be a good doctor. The crash cart calibration matters. The systems work I did in there." "I know," Tran said. "I told you. I read it." "I'm not explaining myself to you, Victor. I'm explaining it to me." She looked up. "I needed somewhere to be that wasn't what I was, for a while." It helped. He accepted that. He was, underneath the rank and the posture and the operational remove, someone who understood the things she was describing. "Okay," he said. From the OR suite behind them, the doors opened. Reeves came out. He was still in his surgical scrubs, mask pulled down, cap in his hand. He looked like someone who had completed a surgery that had required more from him than surgeries usually required, in ways he hadn't expected. His eyes found Megan immediately, which was something she noticed and filed. He crossed the corridor and stopped in front of her. He looked at Tran, at the operators at the stairwell door, at the military legal officer with her folder. His gaze moved across all of it and came back to Megan. "He's stable," Reeves said. "Pressure's holding. We got clean margins on the hepatic injury. Recovery looks good." He paused. "Your margins were exact. I told you they would be." Another pause, the kind that had texture. "Who are you?" he said. It was the third time tonight someone had asked her that question. Each time it had come from a different place. Kellis's confusion, Brody's recognition, and now Reeves's something else. It wasn't confusion. It wasn't recognition. It was the slow, uncomfortable process of a man who had spent 20 years being the most capable person in any given room, becoming aware, all at once, that the woman he'd been treating as a supply runner was something he didn't have a category for. "A nurse," she said. "Callaway Regional." Reeves looked at Tran. Tran looked at Megan. She gave him the smallest nod. He turned to Reeves. "Dr. Reeves, I'm Colonel Victor Tran, 7th Special Operations Support Group. The patient you just operated on is Commander Dale Rourke, one of the most decorated operators in the unit's history. The successful outcome of tonight's surgery is largely attributable to the medical judgment and technical guidance provided by the woman you've been writing up as a supply management problem." He let that land. "Nurse Hart's full service record is classified, but I can tell you that the procedures she executed and directed tonight fall well within her documented capabilities. Capabilities that include 11 years of field trauma surgery in active combat environments, including 3 tours in some of the most austere medical settings the military operates in." Reeves was very still. "She trained surgeons," Tran continued. "She wrote field surgical protocols that are still in active use. She has commendations that I'm not at liberty to name in a civilian corridor." He stopped. "She has been working in your department for 18 months, and in that time you have written documentation describing her as a support worker with limited clinical initiative, and your charge nurse has been building a file to push her out." The corridor was silent. Torres, who had come out of the OR behind Reeves and stopped at a distance that was clearly close enough to hear, had gone pale. Reeves's face had changed in a way that Megan had not expected. She'd expected defensiveness. She'd expected the particular performance of a man who was used to being right, beginning to construct the argument for why he'd still been right, somehow. She'd seen it before, in people like him. Instead, his face had gone very still in a way that looked like something closer to the opposite of that. "That's enough," Megan said. Tran looked at her. "Victor, that's enough for right now." He held her eyes for a moment, then he dipped his chin minimally and took a step back. Megan stood up. She looked at Reeves. His jaw was tight. He was holding himself with the rigid composure of someone who was managing something they hadn't prepared for, and she could see the effort it was taking, and she did not feel the satisfaction she might have expected to feel. She'd been treated badly by him for 18 months. She'd been systematically dismissed and documented and managed toward the door. Some part of her had imagined, in the occasional idle moment, what it would feel like to have this kind of moment. It felt mostly like exhaustion. "The surgery went well," she said. "That matters. That's the thing that matters right now." Reeves looked at her. "You should have told me," he said. His voice was rough. "You should have." "I tried," she said.
In the trauma bay with the pneumothorax. You had me removed. He closed his mouth. I'm not doing this tonight, she said. The patient is in recovery and that's what counts. Go home, Dr. Reeves.
She turned away. Behind her, she heard him not move for a long moment. Then his footsteps, slowly, back toward the OR suite. At 3:30 a.m., Tran's medical officer arrived and took over Rourke's post-op monitoring with the Callaway Regional Recovery Nurse assigned to the suite. Garrett's EOD team had cleared the building. The fragment was in secure containment and on its way to a facility she didn't need to know the name of. Brody was coordinating the operator's exit through the ambulance bay, quiet and methodical, undoing the presence they'd established 3 hours earlier. The trauma floor was almost normal. Almost. Megan was at the nurse's station, writing in her notebook. The small, compressed handwriting. She was documenting things that, not for the hospital chart, but for herself, the way she'd always documented things, the running record of what had happened and what she'd done and what she'd seen. 18 months of notebooks. She didn't know what she did with them. She'd never had to figure that out before. Torres stopped at the edge of the station. She looked up. He was 28 years old, and he had the look of someone who was doing the calculation. Who she was, what he'd witnessed tonight, what it meant for the 2 months during which she'd been quietly pointing him in the right direction without his knowing. His face was doing a complicated thing. You helped me, he said, without me knowing. You were figuring it out yourself, she said. I wasn't, though. He stopped. The blood gas results. Last month, the septic patient. You put the right reference in the chart folder. I thought it was misfiled. I used it anyway. Did it help? The patient did well, he said. She looked back at her notebook. Then it did its job. He stood there for another moment. She could feel him wanting to say something more significant, and she hoped he wouldn't because she was tired and it was 3:30 in the morning and significant things had a way of getting complicated. Thank you, he said. Simple, clean. Go home, Torres. He went. She finished what she was writing. She capped the pen. She sat back and looked at the ceiling for a moment, at the fluorescent lights that buzzed at the frequency she'd stopped noticing 18 months ago. Tran appeared at the edge of the station. 3 hours, she said. Almost. He sat down across from her. Not across a table, so the station wasn't set up that way, just across the space, close enough to talk without the conversation being public. I want to ask you something. You don't have to answer it. She waited. When Brody told you about Rourke on the roof, when he told you the fragment situation, you had about 4 seconds between hearing that and making your first decision. He looked at her. What were you thinking? She considered the question. She thought about the roof, the cold, the rotors slowing, Rourke's color, and his pressure, and the specific way the operators were positioned around him. I was thinking that he had a name, she said. Brody told me his name, and I was thinking about the margin between what could be done and what would happen if nobody did it. That's all? I was also thinking I was going to have a very complicated rest of the night. She looked at him. I was right. Something in Tran's face shifted. Not quite a smile, but something adjacent to one. He looked down at her notebook. What's in those? Everything. He nodded. He understood what that meant. The documentation habit that the military had instilled and that she'd never shed, the running record of everything observed and assessed and decided, the audit trail of a mind that couldn't stop cataloging. The board meeting is at 8 a.m., he said. Hospital administration, some board members, probably media relations. They're going to want to talk about tonight. The classified elements will be excluded from that briefing, but your name will be in it. I know. There will likely be questions about your employment status and your documented history in this department. He paused. The file Kellis was building. She said she's pulling it. Tran raised an eyebrow briefly. She told me tonight, Megan said, in the scrub room. He processed that. Reeves is going to have harder questions to answer. His documentation of the Torrance case, the pneumothorax patient, is going to look very different in light of tonight. I know that too. Are you going to be there at 8 a.m.? She looked at the notebook. At the station, at the trauma bay at the end of the corridor, where the night had cracked open and rearranged everything,
where she'd done the things she'd been telling herself she wasn't going to need to do again. "I'll be there," she said. Tran stood. "Get some rest. There's a call room." "I'm fine." He paused. "Megan." She looked up. "For what it's worth." He stopped, reconsidered, went ahead.
"What you did tonight, with the fragment, with Rourke, with the surgical guidance, that was exceptional work, under conditions that would have flattened anyone who didn't have exactly your background." He held her gaze. "I know you didn't want to need to do it. I know that's not why you were here, but I want you to know I saw it." She held his gaze for a moment. "Thank you," she said. He walked away down the corridor. She sat alone at the station. The monitors beeped in their steady intervals. The lights buzzed. Somewhere in the building, an elevator hummed. All the ordinary sounds of a hospital at 4 in the morning, when the night shift was running on its last reserves and the early shift was still 2 hours out, and everything had a specific quality of in-between. Her pager went off. She looked at it, expecting recovery. Some normal post-op issue, a vital sign query, a medication question. It wasn't from recovery. It was a code from the communications desk. 4 digits, the same 4 digits that had appeared on her pager at 11:30, the ones that didn't belong to Callaway Regional's system. She stared at it. Her phone buzzed. A text from a number she didn't recognize. No contact. No name. 2 words. Situation escalating. She was on her feet before she'd fully processed the next thing. The sound coming from the direction of the recovery suite, muffled through 2 sets of doors but unmistakable, because she'd heard that particular alarm pattern before. In a different context. In a different building. In a different life. Not a patient monitor. A perimeter alarm. She ran. The recovery suite was on the 2nd floor, east wing, and Megan took the stairs. Not because the elevator was slow, it wasn't, but because the stairwell gave her 12 seconds of unobserved movement and she used them. She pulled out her phone and sent 1 word back to the unknown number. Location. Then she was through the stairwell door and moving down the 2nd floor corridor at a pace that was fast enough to cover ground and controlled enough not to announce itself. The alarm she'd heard wasn't sounding anymore. That was either good or very bad, and she'd learned that silence after a perimeter alarm was usually the second thing. Brody met her at the recovery suite entrance. He was already on his radio, his free hand up in a gesture that meant slow down, not here. She slowed. He pulled her into the alcove beside the suite door. "We have an unauthorized access event," he said. "Someone got into the East Wing service corridor on the ground floor. Bypassed the keycard system, musts. Not forced, bypassed. Professional." "When?" 8 minutes ago. We didn't catch it until the automated perimeter sweep." "Is Rourke secured?" 2 operators in the room. He's not the immediate problem." He looked at her. "Garrett's containment unit is in a temporary secure room on this floor. Room 214. The fragment." She understood immediately. "Someone knew," she said. "Someone knew the fragment was here, and they knew which room, and they're good enough to get through a hospital keycard system in under 3 minutes. He lowered his radio. "This isn't opportunistic." "The operation site was compromised." "Has to be. Or the aircraft was tracked." He looked at the ceiling. "Tran is managing the response. We've got operators sweeping the service corridors. But this building is a maze and we're working with civilian security infrastructure." Megan looked at the recovery suite door. Through the small window, she could see the room. Rourke in the bed, monitors, one of the operators visible near the far wall. Stable. Safe, for now. "Where's the legal officer?" she said. "With Tran." "The hospital administrator on call?" Brody paused. "Reeves called him. After our conversation in the corridor. Apparently decided to get ahead of whatever was coming." Of course he had. "Which administrator?" "Man named Hargrove, Deputy Director of Operations. He arrived about 20 minutes ago, and he's been in a closed room with Reeves on the 4th floor. Brody looked at her. "Tran's legal officer is trying to get into that meeting." "Why is Reeves meeting with hospital administration at 4 in the morning?" "That's the question." She thought about the timing. Reeves, coming out of the OR, getting hit with Tran's account of who she was. The look on his face, not the defensiveness she'd expected, something more complicated. And then, apparently, a phone call. A closed meeting. In the 40 minutes since she'd told him to go home. He hadn't gone home. He's not trying to get ahead of the story, she said. He's trying to shape it. Brody said nothing, which was agreement. What's in the temporary secure room besides the containment unit? Garrett's equipment kit, his documentation of the extraction, chain of custody records. If someone accessed that room and the documentation was altered or removed, it would create a gap in the chain, Brody said. And without clean chain of custody on the fragment, the legal case for what it is and where it came from gets complicated. She looked at him. Someone wants the fragment to disappear from the record, or they want the chaos of a compromised record. Either way, they need to be in that room. He checked his watch. We have operators on the floor, but the service corridor connects to the room's utility access, and our sweep team is still 3 minutes out. Show me the layout, she said. He turned his tablet toward her. A building schematic. She memorized it in the time it took most people to get oriented, the old habit, the spatial mapping that lived in a different part of her brain than language. The service corridor ran parallel to the main hallway, accessible through a utility door near the elevators. Room 214 was 14 meters from that door. I'm going in, she said. Megan, your sweep team is 3 minutes out, and the service corridor is a straight line. Whoever is in there is already close to that room. She looked at him. You need someone in position now. You're not armed. I know the building, she said. They don't. He held her gaze for 2 full seconds. Then he reached to his vest and produced a small radio, already on frequency. Direct line to me. You do not engage. You observe and report. Understood. I mean it. I heard you, Alan. She took the radio and moved. Got. The utility door opened with a staff keycard. Hers, which still worked, which was its own minor piece of information, and she was into the service corridor before the door had fully closed behind her. It was narrow and poorly lit, the kind of infrastructure space that buildings had and nobody thought about. Pipes along the ceiling, conduit boxes, the smell of dust and electrical heat. She moved with her back to the left wall and her eyes forward and her breathing quiet. 14 meters to room 214's utility access. At 11 meters, she stopped. Someone was ahead of her. She couldn't see them yet. The corridor bent slightly, but she could hear the specific absence of sound that a person in a space created when they were trying not to make any. She'd learned to hear that in environments where the difference between hearing it and not hearing it was the difference between going home and not going home. She pressed against the wall. The radio in her hand stayed silent. She wasn't going to key it. Keying it would produce noise. She waited. The person ahead moved. She got a visual for about 2 seconds. Figure in dark civilian clothes, compact, carrying a hard-sided case that was not Garrett's, moving toward the utility access panel for room 214. Not looking back. Focused on the panel, which meant they had a technical objective and they were close to it. She keyed the radio twice. Short. The signal she and Brody had established with a look and a nod. Contact. Holding. Then the utility access panel opened and the figure went through it. She was moving before she'd made the decision to move. 14 meters to the panel, which was still open. She went through it. Room 214's utility space was a narrow service closet built into the back wall of the room itself. A vestigial space from the building's original construction, accessible from both the corridor and the room side. The figure was at the interior door, working the lock, and they were good. Megan could see the speed of it, the trained economy, but they hadn't heard her come in, which meant their situational awareness was task-focused rather than perimeter-focused. That was a mistake. She'd seen it before. People who were very good at one specific thing sometimes forgot to be good at everything else at the same time. She was 3 feet behind them when she said, "Don't." The figure stopped. Step away from the door and put the case on the floor. A beat. She watched the calculation happening in their posture, the assessment of options, the math of the situation. She had nothing in her hands. They had training, and probably more than a case. "The case," she said. "On the floor." They set it down. "Now the door." They stepped back. "Turn around," she said. They turned. Male, late 30s, the face of someone who was professionally anonymous, not memorable in any specific way, which was its own kind of craft. He looked at her without expression. His eyes were doing the same calculation his posture had done. "You're not security," he said. "No." "You're the nurse." She said nothing. Something shifted in his assessment of the situation. She could see it. Not fear, not quite, but a recalibration. You should walk away, he said. This isn't your situation. It became my situation about 4 hours ago. She kept her voice level. The operators sweeping this floor will be here in about 90 seconds. That case is staying where it is. He looked at the case, then at her, then at the interior door. He went for the interior door. She was between him and it before he'd taken the second step, not because she was faster, she wasn't, or not by much, but because she'd already mapped the space and he'd underestimated her reach, and the confined dimensions worked against someone who needed momentum. She took the impact on her left shoulder, which was going to make tomorrow unpleasant, and she used his forward movement against him, redirecting rather than stopping, the way you dealt with someone bigger when stopping wasn't a viable option. He went into the wall. He recovered faster than she'd expected. He was good. She acknowledged that. He was genuinely good. And he turned with something that was going to end badly for her if it connected. The utility closet door behind her opened. 2 operators came through in the time it took to exhale, and the situation ended. Yeah. She sat on the floor of the service closet with her back against the wall, and her left shoulder throbbing in a steady, medically interpretable way that told her nothing was broken, but something was going to be very stiff. The operators had the intruder controlled and were talking into radios in the terse shorthand of people reporting a contained situation. The case was on the floor where she told him to put it. Brody was through the door in under a minute. He looked at her on the floor, then at the operators, then at the case. His face ran through several things in quick succession before settling on something that was part relief and part the specific expression of someone who had said, "You do not engage," and was now looking at evidence that this had not been fully honored. "I didn't engage," she said. "He engaged. I redirected. Your shoulder is fine. Is it? It will be." She looked at the case.
What's in it? Garrett was there now. He'd come through behind Brody, and he crouched over the case without touching it, studying the locks and the exterior. Not our equipment. Could be a duplicate containment unit. He looked up at Brody. They were going to swap it, take the real fragment, and leave us with an empty case. And the chain of custody records? If they'd gotten into the room, they could have accessed Garrett's documentation kit, Brody said. Altered the extraction records. Made it look like the fragment was here and then wasn't, or was never what we said it was. It would create grounds to dispute everything, Garrett said quietly. The device type, the threat classification, the whole operational context. The intruder, now secured against the opposite wall, said nothing. He'd said nothing since the operators had arrived. That was professional, and it told her something about who he worked for. People who were trained to go silent immediately and stay there, which narrowed the category considerably. Megan pushed herself to her feet. Her shoulder protested. She ignored it. "Tran needs to know," she said. "Already called," Brody said. "He's on his way down." He looked at her. The administrator meeting on 4, Tran's legal officer got in. Reeves and Hargrove have been up there for 40 minutes, and Reeves has been doing most of the talking. "What's he saying?" Brody's expression shifted in a way that was specific and not quite readable. He was telling Hargrove that tonight's events were the result of a staff member operating outside her scope, and that the military's involvement created a liability exposure for the hospital, and that the appropriate response was to manage the narrative before morning. She absorbed that. "He was trying to get Hargrove to issue a statement before the board meeting," she said. "Yes." "What kind of statement?" "The kind that described tonight as an unusual but handled situation, credited the hospital's trauma team, and specifically Reeves, and noted that an auxiliary staff member had been present in an unofficial capacity." Brody looked at her steadily. "Essentially, the version of tonight where you were an over-eager nurse who happened to be nearby." The corridor was very quiet. She looked at the case on the floor, at the intruder against the wall, at the operators and Garrett and Brody in the narrow utility space that smelled like old dust. "Did Hargrove agree?" she said. "He was close to it." Brody paused. "Until Tran's legal officer put the classified service record summary on the table. Hargrove has been very quiet since." She thought about Reeves, his face in the OR corridor, the stillness she'd taken for something approaching reckoning.
She'd been wrong about that, or partially wrong. He'd processed what Tran had said, and his first move had been to get to administration before the morning, to get control of the shape of the story. Not because he was malicious, she thought, because he was threatened, and threatened people with his particular kind of ego move toward self-preservation the way other people move toward honesty. He's not going to get away with it, Brody said. I know. Tran is going to make sure of that. I know, she said. I'm not worried about Reeves. She was looking at the case on the floor, at the man against the wall who'd been sent here to erase the evidence of what had happened tonight, to hollow out the factual record and leave a version of events that served someone else's purpose. He'd gotten in through a bypassed keycard system. He'd known which room, which door, which equipment. The operation site was compromised, she said. You said that. Or the aircraft was tracked. Yes. Both of those require advanced intelligence. Yes. About Rourke specifically. Brody looked at her. That's where Tran's team is working right now. She looked at the intruder again. At his face. Professionally anonymous, deliberately unmemorable. At his clothes, his case, the specific way he'd worked the lock. He wasn't trying to destroy the fragment, she said slowly. He was trying to take it. That's what the swap case suggests, yes. Which means someone wants it intact. For analysis. To understand what it is and how it was made. She looked at Brody. Tran's 3 levels above his clearance on the device specs. Who's above Tran? Brody was very still. That's a question I can't answer in a hospital corridor, he said. Can you answer it in any corridor? He held her gaze for a moment. No. She nodded. She'd expected that too. Tran arrived through the main corridor door with 2 additional operators and his legal officer. He took in the scene in about 4 seconds. The intruder, the case, Megan's shoulder, Garrett's crouched position, and the senior officer control of his expression held, but she could see the tension underneath it. Status? He said to Brody. Brody gave him the 30-second version. Tran looked at Megan. Your shoulder is fine. Get it assessed. After. He looked at her for a moment, then he crouched beside the case the same way Garrett had, not touching it, just looking. This is the 3rd time since 0300 that you've been the critical variable in this situation, he said, without looking up. She said nothing. The first 2 times I told you I wasn't here to drag you back. He stood. That's still true. He looked at her. But I want to ask you something different. Not about the job. Not about any of this. He paused. Are you all right? The question landed differently than she'd expected. She thought about it honestly, which wasn't something she always did with that question. Her shoulder throbbed. She'd been on her feet for 7 hours. She'd guided a surgery, managed a classified fragment, navigated 3 conversations that had each required a different kind of precision, and just spent 40 seconds in a dark utility corridor with someone who'd meant her harm. I'm operational, she said. That's not what I asked. She looked at the wall. I'll tell you when I'm not. He accepted that. The board meeting is in 4 hours, he said. Reeves's attempt to shape the narrative with Hargrove is done. My legal officer has his statement and she's comparing it to the documented record right now. He looked at Brody. I want this corridor cleared and secured, and I want someone with eyes on Reeves until morning. Brody nodded and moved. Tran turned back to Megan. The board meeting, he said. They're going to ask questions about your employment history, your qualifications, the decisions made tonight. I know. And they're going to look at Reeves's record of the Torrance case, the documentation that erased your assessment of the pneumothorax. He paused. And they're going to look at Kellis's file, or the absence of it. She said she was pulling it. She did pull it. Deleted the digital copies at approximately 3:45 a.m. He raised an eyebrow, fractionally. We know because our legal officer was monitoring the hospital document system as part of the briefing preparation. Megan absorbed that. And the deletion itself is visible in the system audit log, which means anyone looking at the record can see that a file existed, was built over 4 months, and was then removed in the middle of the night. He looked at her steadily. It doesn't erase what Kellis did. It just adds a layer of documentation to it. She thought about Kellis in the scrub room, the rawness on her face, the specific cost of what she'd said, She didn't delete it to cover herself, Megan said. She did it because she meant what she said. I believe that, Tran said. It doesn't change what the audit log shows. What happens to her? That depends on the board. And on you. She looked at him. You're going to have standing in that meeting, he said. More than you might expect. What you say about the people in this department, what you ask for, what you don't ask for, it's going to carry weight. She thought about that. About Kellis and Reeves and the 18 months and the supply room and the file. About Torres, who was going to be a good doctor. About the crash cart in Bay 3. I'll handle it, she said. I know you will. Tran glanced at the corridor. Get your shoulder looked at. I'll find you at 7. He moved away to confer with his operators. Megan stood alone in the hallway outside room 214. Through the door, he could hear the steady beeping of the monitors where Rourke was sleeping off the anesthesia. Stable. Alive. The fragment gone, the chain of custody intact, the attempted swap foiled. She should go get her shoulder examined. She knew that. It was the sensible, clinically appropriate thing to do. She went upstairs instead. The 4th floor was quiet. Administrative offices, mostly dark, the kind of institutional silence that corporate spaces had at 4 a.m. She walked to the room where Brody had said Hargrove and Reeves had their meeting, and she stood outside the door for a moment. Inside, she could hear 2 voices. Tran's legal officers, level, precise, and Reeves's, which was doing something she hadn't heard from it before. It was lower than usual, less certain. She didn't go in. She stood in the corridor and listened to the tone of it, not the words, the way you assessed a situation from the outside when you needed to understand the state of play without being seen. Reeves's voice had lost the practiced cadence of authority. It was searching for something, a foothold, a framing, a version of events that could still be workable, and she could hear it not finding one. That should have felt like satisfaction. Maybe later it would. Right now it just felt like a fact. She turned and walked to the window at the end of the corridor. Outside, Portland Heights was doing what it always did before dawn. The pre-gray light, the empty streets with their wet pavement, the overpass in the distance where, 18 months ago, she'd driven across it and thought, here, this is far enough. This is where you stop for a while. Her phone buzzed, the same unknown number. Another 2 words, package secured. Then, a second later, a 3rd message from the same number. Who are you working for? She stared at that for a long moment. The intruder in the utility closet, who was now in a secure room somewhere in this building, in military custody, saying nothing. Sent by someone who knew about the fragment, and about Rourke, and about the aircraft's route. Sent by someone with the resources to get a man into a civilian hospital past a keycard system in under 3 minutes. And now a phone, which shouldn't exist, reaching out to her specifically, which meant they knew her phone number, which meant they'd known she was here before tonight, before Rourke, before the roof. She looked at the message for a long time. Then she walked back toward the stairwell. She needed to find Tran, not in 4 hours, not at 7 a.m., right now, because the intruder hadn't been sent for the fragment. She understood that now, the way you understood things when the pieces settled into the right geometry, the wrong direction entry point, the swap case that would have created chaos but not erasure, the message on her phone from a number that had her contact. He'd been sent to find out if she was here, and now someone knew the answer. She found Tran in the stairwell between the 3rd and 4th floors, which told her he'd been moving too, that something had already shifted in the operational picture and he was in the process of managing it. He saw her face and stopped. "Show me," he said. She held out the phone. He read the messages, all 3, the package secured, the who are you working for, and the timestamp that told him how quickly they'd arrived after the intruder was contained. He didn't say anything for a moment. He turned the phone over in his hands the way you handled something that had changed the shape of a situation. "They had your number before tonight," he said. "Yes." "Which means they had your identity, your cover here." "Yes." "How long do you think they've known?" She thought about it honestly. "I don't know. Could be recent. Could be from the beginning." She looked at the phone. "The message asking who I work for. That's the interesting one." Tran looked at her. "They know I'm here. They know what I did tonight, but they don't know whose side I'm on." She paused. Which means their intelligence on me has limits. They know the name, the location, maybe the background. They don't know the context. Or they know the context and they're testing you. Also possible. He handed the phone back. His expression had settled into something that was making calculations she couldn't fully see. "The intruder," she said. "Have your people gotten anything?" Nothing verbal, but his equipment is being processed. The bypass device he used on the keycard system has a specific technical signature. Our intel team recognized it. It's been seen twice before, both times in operations attributed to a private contractor group that has been linked to at least one hostile state actor in the past 18 months. He looked at her. "The fragment is more valuable than we initially assessed. The device it came from, the weapons program, it's further developed than Command thought. Someone external wants the technology, and they've been tracking this operation from before Rourke went into the field, which means Rourke was compromised going in." Almost certainly. She absorbed that. 22 years, Brody had said, decorated. The kind of operator who'd been doing this long enough that the system trusted him completely, and the system had sent him into a field that was already being watched. "He needs to know," she said. "He will, when he's conscious and stable enough." "How long?" 6, 7 hours. Tran looked at his watch. It was approaching 5. "The board meeting is in 3 hours. I need you functional for that." "I am functional." "Your shoulder." "Victor." "Megan." He held her gaze. "Get it looked at. Eat something. I'll have Brody brief you at 6:30 on the full operational picture. And we'll go into that board meeting with everything we have." He paused. "After that, whatever you decide, I'll honor it. But right now I need you to take care of yourself for 90 minutes. Can you do that?" She looked at the stairwell wall. The institutional paint, the number 3 stenciled near the door. "There's a call room on this floor," she said. "I know. I'll take the shoulder to the ED resident on duty, then the call room." "Thank you." She started up the stairs. Stopped. "Victor?" She turned. "The message. Who are you working for? Don't respond to it." "Obviously." "But don't block the number either." He looked at her for a moment. Then he nodded, once, and she went upstairs. The ED resident was a 24-year-old named Park, who was in the last hour of a brutal overnight shift and had the particular glassy focus of someone running on borrowed energy. He examined her shoulder with competent hands and confirmed what she already knew. Nothing broken, significant soft tissue impact, going to be stiff and unpleasant for several days. He gave her an ice pack and a look that said he had questions he'd decided not to ask. She thanked him and went to the call room. She lay down on the narrow bed without taking off her shoes and stared at the ceiling for approximately 4 minutes. Then she slept, which was a skill she'd developed the same way she'd developed most of her skills, by needing it badly enough and often enough in conditions that required it until her body learned to do it on command. She woke at 6:28. 2 minutes before Brody knocked. Mess. He gave her the full picture in 11 minutes, sitting in the call room with the door closed and his tablet on his knee. The intruder's equipment had confirmed the contractor link. Command had already moved to secure the broader operation. Rourke's mission parameters were being reviewed. The field intelligence that had preceded the operation was being pulled and audited, and 2 people at a level above Tran's visibility had been placed on administrative hold pending a counterintelligence assessment. "How high?" Megan asked. "High enough that I can't tell you in a call room." She didn't push it. She'd been in the world long enough to know that some information only became dangerous when it traveled. "The phone messages," Brody said. "We've had the number traced. It's a burner, purchased in Seattle 4 days ago. Whoever sent those knew the fragment operation was going to happen before Rourke's aircraft went down. This wasn't reactive. They were positioned. And they wanted to know if I was a variable," she said. "You specifically." Someone who knew what a fragment like that was on site. Someone who could manage it in a civilian context without flagging it to the wrong people. She looked at the wall. They wanted to know if there was a threat to their extraction plan that they hadn't accounted for. And now they know there was. "Yes." Brody was quiet for a moment. "Does that concern you?" She thought about it.
It means I need to be careful for a while. It doesn't mean anything else. He looked at her the way he'd been looking at her since the roof. That evaluating look, the one that was part professional assessment and part something more personal. The look of someone who'd known her in a different context and was reconciling that with the person in front of him now.
She'd been letting it exist without addressing it because there hadn't been time. But the board meeting was in an hour, and some things were better settled before you walked into a room full of people who were going to be watching your face. "Say it," she said. "I didn't say anything." "You've been about to say something since the roof." He looked at his tablet, then at her. I want to know if you're okay. Not operationally. I know you're operationally fine. I mean," he stopped. "You spent 18 months here, letting people talk to you like that. I've known you for 9 years, and I've never—" He stopped again. "It wasn't degrading," she said. "Or, it was. But that wasn't why I stayed." "Why did you stay?" She thought about Torres getting a blood gas right, the crash cart calibration, the way a supply room ran better when someone organized it with actual intention, the specific unglamorous utility of just being present in a place and doing what needed doing without anyone needing to know your name. "I was tired," she said. "Not the kind of tired that sleep fixes, the kind that comes from years of everything mattering enormously, every decision, every second. I needed somewhere that was smaller for a while." She paused. "And then it turned out even the small place had things that needed doing, so I did them." Brody looked at her for a long moment. "That's very you," he said. "Don't make it sentimental." "I'm not." But something in his face was, just a little, just enough to be human. "Go brief Tran," she said. "I'll be downstairs at 7:50. He went. She sat alone for a few minutes. Then she took out her notebook and wrote one last entry in the small, compressed handwriting. She didn't read it back. She capped the pen and put the notebook in her breast pocket and stood up and went to find out what came next. The boardroom on the 5th floor had 12 chairs and 10 people in them by the time Megan arrived at 7:52, which meant it had been running for 2 minutes already, which meant someone had started without her, which was fine. She'd done enough in the last 9 hours. She could afford to walk into a room late. Tran was at the table, his legal officer beside him. Brody stood near the window. The hospital board was represented by 3 people she didn't know, 2 in their 60s, 1 younger, all with the assembled for a crisis look of people who had received a phone call at an early hour and had not yet fully calibrated how serious the situation was going to be. Hargrove, the deputy director, was at the far end. He looked like someone who had not slept and who was aware that the meeting he'd had with Reeves at 4 a.m. was now a liability. Reeves was there. He was in fresh clothes. He'd gone home at some point, briefly, and he sat with the controlled stillness of someone who had spent the drive back constructing a position and was holding it. His face was composed, experienced, the face of a man who had been in uncomfortable professional situations before and had survived them. Kellis was not in the room, which was its own kind of information. Megan sat down. One of the board members, the older woman who had the posture of someone who ran meetings rather than attended them, looked at her. "You're Nurse Hart." "Yes." "We've heard a preliminary account of last night's events from Dr. Reeves and from Colonel Tran's legal officer. We have some questions." "All right. Dr. Reeves has characterized your involvement in last night's surgical case as well-intentioned but outside your designated scope, and has raised concerns about the protocols observed during the military interaction." She looked at Tran's legal officer. "Colonel Tran's office has provided a different account." "Yes," Megan said. "I imagine they have." Reeves's jaw tightened. She saw it. "Can you walk us through your actions last night from the point of the military aircraft's arrival?" She walked them through it. She was precise, and she was economical, and she left out the classified elements. Brody's visible nod told her Tran's legal officer had already handled the redaction framework, and she described exactly what she'd done, in sequence, and why, in the flat and specific language of someone documenting a procedure. No drama, no framing, just the account. When she finished, the boardroom was quiet. The younger board member, Shmashan, the one in his 40s who had been making notes, looked up. "The initial pneumothorax case, the Torrance patient,
You identified the condition before Dr. Reeves. Yes. And Dr. Reeves's documentation of that case attributes the identification to the attending physician. Yes. Can you confirm that your assessment preceded his? She looked at Reeves. He was holding himself very still. Yes, she said. There are witnesses to that? The nursing staff on shift, residents present. Security may have footage of the corridor interaction. Hargrove was looking at the table. Reeves said, I need to speak. His voice was controlled, but the control was doing visible work. I want to be clear that the Torrance case was managed correctly. The clinical outcome was good. Any characterization of documentation irregularities? Dr. Reeves. The older board member's voice didn't rise. You'll have an opportunity to respond. Nurse Hart has the floor. It was a small thing, a procedural thing, but the silence that followed it in the room had a specific quality. The quality of a shift, the moment when the weight of a space begins to transfer from one side to another. Reeves sat back. Is there anything else you want to add? The board member asked Megan. She thought about what Tran had said in the corridor. What you ask for, what you don't ask for, it's going to carry weight. I want to say something about Donna Kellis, she said. She felt Brody look at her from the window. There was a documentation file. I was aware it existed. I'm told the board may be reviewing it as part of this inquiry. She paused. I want to say that Nurse Kellis removed that file on her own initiative in the early hours of this morning. She told me directly that she regretted building it. I'm not asking for that to be ignored. I'm asking for it to be considered accurately, as an action she took herself without being asked before any formal review was initiated. The room absorbed that. That doesn't erase the conduct, the board member said. I know, I'm not saying it does. She looked at the table. I'm saying she made a choice when it was still hard to make it. That's worth noting. Tran's legal officer wrote something. Then the older board member turned to Reeves and the room's gravity changed again, and Megan sat back and let it happen. It took 2 hours. Reeves's prepared position didn't survive past the first 40 minutes. It cracked along the line she'd always known it would crack, the Torrance documentation, which was clean and time-stamped and contradicted by 3 staff members who had been in the corridor and who, when formally asked, gave accounts that matched Megan's and not Reeves's. The security footage existed. It showed exactly what had happened, including her being walked out of the bay and the code alarm going off 90 seconds later. He shifted. She watched him shift in real time, the way a structure shifted when its load-bearing element failed, not all at once, but progressively, each adjustment revealing the next weakness. He moved from the documentation is accurate to documentation captures clinical judgment, not the sequence of events to I acknowledge there was a miscommunication to, finally, a silence that lasted about 8 seconds, which in a boardroom was an eternity. Then the board member asked about the advisory from Tran's legal officer, the classified summary of Megan's service record, appropriately redacted, which confirmed her capabilities and her qualifications and her 11 years of field surgical support in conditions no one in this room could fully imagine. Hargrove asked to be excused partway through that section. Nobody stopped him, but everyone noted it. By 10:15, the board had enough. The older board member thanked the military officers and closed the meeting, and as people stood and chairs pushed back, there was a specific quality to the movement, the way you moved when something had been decided, even if the formal language of it would take longer. Reeves walked out without looking at Megan. He was a good surgeon. She'd meant it when she said it, and she meant it now. But good hands weren't the same as good character, and he'd spent 20 years confusing the two, and the consequence of that confusion was always, eventually, this, the moment when the gap became visible to everyone at once. She didn't feel triumphant. She felt something quieter and harder to name, like the end of weather. Tran found her in the corridor afterward. The board will issue a formal review of the Torrance documentation, he said. Reeves has been removed from his chief of trauma position pending that review. He'll keep his clinical privileges while the investigation runs, but he won't lead the department. How long does the review take? 3 to 6 months. Based on what they have, I'd expect a permanent change in his role. She nodded. Kellis is on administrative leave while HR reviews the file situation. Tran's legal officer has indicated that the circumstances, including her voluntary action this morning, will be part of the assessment. He paused. That's not a guarantee, but it's not nothing. What about Torres? Tran looked briefly surprised. The resident? Yes. He's not under review. He performed well last night. I know. I'm asking what happens to him when the department leadership changes. Tran considered it. The interim chief will be appointed by the board.
The department will run differently than it has been. He looked at her. I can make sure his trajectory is noted. Do that, she said. He held her gaze for a moment. You're still running the department in your head. Old habit. You know what I'm going to ask you next. She looked down the corridor. Through the window at the end, she could see the Portland Heights skyline doing what it always did. Gray and wet and specific, the particular visual texture of a city she'd chosen for its anonymity, and had then, against her plans, begun to know. The unit needs a field medical coordinator, Tran said. Not a field position. That's not what I'm offering, and I know it's not what you want. A training and advisory role. You'd be stateside, primarily. You'd be developing the next generation of field surgeons the way you developed the last one. Your protocols, your methods, on your terms. She was quiet. You've been doing that work anyway, he said, for free, in a hospital supply room. You may as well do it with the resources to do it right. It's not a supply room anymore, she said. It hasn't been for a while. I know. He was quiet for a moment. I'm not asking you to be what you were. I'm asking you to be what you are, which is, apparently, someone who can't stop making the thing around her better. He paused. There are a lot of Tauruses out there, a lot of residents making wrong calls under pressure because nobody taught them the right way. She thought about that, about the blood gas reference she'd slipped into a chart folder, about the crash cart calibration, about the long, slow, invisible work of making a system incrementally less broken. She'd been doing it here. She could do it at scale. I want the terms in writing, she said. Obviously. And I want input on the curriculum. That's the job. And I want a week before I answer officially. Tran nodded. You've got 10 days. I'll have the document to you by end of week. She looked at the skyline again. Rourke, she said, when he's conscious, tell him I want a report on his recovery timeline. He doesn't know me, so make sure he understands it's a medical question, not a courtesy. He'll know who to thank. That's not why I'm asking. She looked at Tran. I want to know he's actually doing the work. Patients lie about their recovery. Operators lie more than most. Tran made a sound that was very nearly a laugh. I'll tell him. He extended his hand. She shook it. Ouch. She went back to the trauma floor. Not because she had to. Her shift didn't start for 6 hours, and given the circumstances, she doubted anyone was going to ask her to restock supplies. She went because there was something she needed to do, and she wanted to do it before the day got any further along. The floor was running on the morning rhythm. Day shift arriving, night shift handing off, the particular energy of a department switching gears. 2 nurses she didn't know well gave her looks as she passed. Not dismissive. Not the look she'd been getting for 18 months. Something different. She noted it and kept moving. Torres was at the workstation, still there from the overnight, which meant he'd never gone home. He looked up when she stopped in front of him. You should go sleep, she said. I know. He didn't move. He had the look of someone who had been sitting with something for a while and had decided to say it. I heard about the board meeting. It's still running. I heard enough. He paused. The blood gas. And the other things. I know it was you. She waited. I need to know if I'm actually good or if I've been getting it right because you were handing me the answers. She looked at him, 28 years old, hollow-eyed with exhaustion, genuinely asking. You asked the right questions, she said. Every time. I just put the information where someone who was asking the right questions would find it. She paused. The diagnosis is never the information. It's knowing what question to ask first. You've been doing that. That's yours. He let out a breath. Something in his posture settled. Okay, he said. Go home, Torres. This time he went. She found Kellis in the break room. Donna Kellis was sitting at the table with a cup of coffee she wasn't drinking, in her street clothes, which meant she'd been told to go home or had decided to herself. She looked up when Megan came in, and her face did the complicated thing again, the one that still didn't have a clean category. "The board meeting," Kellis said. "Done. For now." "What did you say about me?" "What I told you I would say. That you acted on your own initiative. That it should be considered accurately." Kellis was quiet for a moment. "I wouldn't have done that for you." "I know." "So why?" "Because it's true," Megan said, "and because the accurate version of events is the version I want on the record, not the convenient version, not the punishing version, the true one." She looked at her. "The file was real. What you did with it was real. And so was what you did it for this morning. The board gets to weigh all of it." Kellis looked at her coffee cup. "I treated you like you were nothing. You treated me like what I appeared to be, which I'd gone to some trouble to arrange." Megan paused. "You weren't the only one. Reeves, among others." Kellis looked up. "Did you know? When you came here? Did you know this would happen eventually? That you'd have to—" "No," Megan said. "I thought I was going to quietly leave in a few months. I thought nobody was ever going to know anything." She paused. "I was wrong. You saved his life. Reeves would have killed him. Reeves is a good surgeon. He would have found the pneumothorax eventually. Not before. Maybe not." She looked at the door. "It doesn't matter now." Kellis put both hands around her coffee cup. "What happens to you now?" Megan thought about Tran's offer, about the document she'd received by end of week, about Torreses, plural, out in the world making wrong calls under pressure. "Something different," she said. Kellis nodded slowly. She didn't ask what. Maybe she understood that some information was given when the person was ready to give it, and pushing didn't make that happen faster. "For what it's worth," Kellis said, "you were the best nurse on this floor, even when I was telling myself otherwise." Megan looked at her. "That's worth something," she said. "Yeah." She left the break room. Guam. She went to her locker. Inside, an extra set of scrubs, a pair of running shoes she'd never used, a spare notebook, blank, still in its packaging, and the small collection of things that constituted a working life in this building. She stood in front of the open locker and looked at it. She took the blank notebook and left the rest. At the nurse's station, she picked up her Callaway Regional badge, the laminated ID with her photo and her title and the department name. She'd carried it for 18 months. She'd worn it every shift. She'd been waved through doors with it and talked past as though she weren't there with it around her neck. And she'd done the work she needed to do anyway, every day, quiet as water, finding the places the ground was low. She held it in her hand for a moment. She set it down on the desk. Not dramatically, not slowly, just she put it down and stepped back and looked at it once and then didn't look at it anymore. Brody was in the corridor. He'd been there for a while, she suspected, because that was what Brody did. He maintained a perimeter. He kept someone in view. He stayed close to the operational situation until it was fully resolved. He looked at the badge on the desk. At her. "Ready?" he said. She picked up her jacket from the hook. The notebook went into her pocket. Blank, for now, waiting for whatever needed to be documented next. "One thing," she said. She walked to Bay 3. It was empty for the moment, that particular lull between overnight cases and the morning's first intake. The crash cart sat against the wall, exactly where she'd left it after the calibration. The IV stand was positioned correctly. The supply cart was stocked and ordered, third shelf, back wall. She looked at it. 18 months of small corrections, small improvements, the slow accumulation of 100 things done right in a place that hadn't known to ask for them. It wasn't visible. It was never going to be visible. That wasn't the point of it. The point was that someone, sometime today, was going to need the crash cart, and it would work. The point was that a patient was going to come in, and the IV tubing would be right, and the supply would be there, and the resident would ask the right question because she'd spent 2 months slipping the right information in front of him. That was the work. It always had been. Not the moment in the spotlight, not the surgery, not the board meeting. The unglamorous, invisible daily decision to make the thing better than you found it. whether or not anyone was watching, whether or not anyone would know. She'd done it in combat zones, and she'd done it in this supply room, and she was going to do it somewhere else now, at a different scale. And the through line between all of it was the same. The work mattered. The person in front of you mattered. The gap between what was being done and what could be done was not someone else's problem. She turned and walked out of the bay. Brody fell into step beside her. "The shoulder," he said, "is sore. But fine. But fine." They walked down the corridor toward the exit. The morning shift was in full motion around them. Nurses crossing, a gurney being moved, the call board showing 2 incoming cases. The ordinary metabolism of a place that kept running, regardless of what happened in its 4th-floor boardroom, regardless of who had been humiliated or vindicated or quietly, invisibly useful. She pushed through the stairwell door. In the lobby downstairs, through the glass doors, she could see Tran and 2 of his operators at the military transport vehicle. The Portland Heights morning was gray and damp in the specific way of that city, the kind of gray that wasn't bleak, just honest about what it was. Somewhere in the building behind her, Dale Rourke was sleeping off the surgery that had saved his life. Somewhere on the 4th floor, the formal consequences of a 20-year pattern of arrogance were beginning to be written down. She pushed out into the morning air. It was cold. Her shoulder ached. She was tired in the specific, clean way of someone who had spent everything they had on something that mattered, and she hadn't slept enough. And there was a conversation with a counterintelligence officer in her near future that she wasn't looking forward to, and the offer on the table from Tran was going to take genuine thought before she answered it. None of that was resolution. None of it was tidy. But Rourke was alive, and the fragment was contained, and the truth about who she was had been spoken plainly in a room full of people who needed to hear it, and the man who had put his name on her work was going to have to answer for that in writing. And somewhere in the building, a young resident was driving home to sleep. And he was going to wake up tomorrow and go back to work and ask the right questions. And he was going to keep doing that because someone had believed, without telling him, that he was worth the investment. That was enough. It had always been enough. Tran looked up as she came across the parking area. He read her face the way he'd been reading her face for 11 years, the particular competence of someone who knew you not from what you said, but from how you moved when you weren't thinking about it. "Good," he said. She stopped in front of him. She thought about every shift she'd clocked into this building, every supply run, every correction made in the margins where no one was looking, every time someone had talked past her, or through her, or around her as though she were a fixture rather than a person, and she'd let it happen because she'd needed to be somewhere small for a while, and because even in the small place the work had found her, and she'd done it. You didn't need recognition to know your own value. That was the thing people got backwards. They thought the recognition was what made the value real, but the value was there before anyone saw it. It was there in every calibrated crash cart, and every correct diagnosis, and every late-night surgery where the right hands knew where to stop, whether or not anyone said so. The saying so mattered. She wasn't going to pretend it didn't. The board meeting mattered. The truth being said out loud mattered. The specific satisfaction of having the record reflect reality mattered. Those things were real, but they weren't the source. The source was the work. The work had been its own argument all along. She'd just been the only one listening. "Yeah," she said to Tran. "Good." She got in the vehicle, the door closed. The city moved past the window, the overpass, the hospital receding in the side mirror, the wet streets of Portland Heights doing their ordinary morning. Somewhere behind her, a building full of people was waking up to a different version of a story they thought they'd known. She opened the blank notebook to the first page. She picked up her pen. She started writing.